Time for your health check this Monday, as September is Prostate Cancer Awareness Month. According to the American Cancer Society, 1 in 8 men will be diagnosed with prostate cancer sometime in their lifetime, and in some cases, they may require surgery to remove the prostate, which could cause prolonged urinary or functional issues. But a relatively new robotic procedure could help with that. Early data shows quicker recovery and a better quality of life after surgery.
Most recently, a purpose-built robot was introduced, a new generation of robots that have one cannula, so one cut. Through that comes all the instruments and camera. So only one cut in the belly of the patient to perform the surgery of removing the cancerous prostate.
Urologists for Cleveland Clinic are some of the first surgeons in the country to perform this procedure. They say there are some key differences between this kind of procedure and others. For example, that single incision robot goes in through the bladder, makes it easier to focus exactly where the disease is located. They say it helps minimize a patient's pain and quickens recovery time. Now, the Cleveland Clinic has performed more than 50 cases to date. Meanwhile, the COVID-19 pandemic took a big toll on a lot of folks' mental health. However, some also became more resilient as a result. Cleveland Clinic psychologist Dr. Susan Albers says it is one of many positive changes to come out of the last couple of years.
Cognitively, this is really important for the future. This helps people to not fear change or bad things happening because they know that they can cope with it, they have social support, and they can adapt to the situation.
Dr. Albers says the pandemic also triggered more conversations about mental health. She says that helped reduce stigma. Many people have had to find new ways to cope if they couldn't get to the gym, maybe connect with family, friends. Research shows that some still continue with new habits, even now that restrictions have largely ended. Another benefit, she says, people learned how to say no and set some boundaries. Finally, Dr. Albers says technology was used for good during the pandemic, with virtual therapy appointments becoming more widely available when it comes to mental health concerns.